So we're talking about polycystic ovarian syndrome. Obviously, we always start out with a picture. This is a picture that I found online, and I found it actually quite good because in one picture you kind of see what it is all about. But I just found it a good slide that kind of like shows you in one eye, okay, this is what PCOS is about, and this is what these people are struggling with. But I will explain later. First, we'll be starting with the definition. We'll be going to signs and symptoms. We'll go over some causes, a diagnosis, and how you make it, and what we can do about it, the treatment, obviously, and also prognosis. Prognosis basically means how do people live with this further, and how will this medical condition kind of affect them throughout the rest of their life. But obviously, before we give you the definition, we need some much needed vocabulary like we always do. I always say medicine is as much as vocabulary. It's kind of like learning a new language. So I'll be teaching you 4 words today: androgens, estrogen, assist, and the hypothalamic pituitary ovarian axis. I dare you to say that 5 times in a row. Hypothalamic pituitary ovarian axis. Hypothalamic. No, fuck that. So first, what are androgens? Actually, medicine is very easy if you know what the language is. Andro means man in Greek, so it has to do something with men, right? Androgens are basically hormones that regulate the development and maintenance of male characteristics. For example, what are male characteristics? Hair, beards, all of that, odor. So it actually does that. So androgens are hormones. Androgens, they're present in males and females, and the most common hormone that is known that is to be male hormone is testosterone. This picture right here might seem like a lot, but the only thing that you need to remember is that testosterone is made out of cholesterol. Everyone kind of like knows what cholesterol is. So cholesterol is inherent for you to be able to make testosterone. It's not the only factor, but just so you know, okay? That's the only thing you need to know, okay? And from testosterone, you can make female hormones, estrogens, okay, like estradiol, for example. So you have to notice you need cholesterol, you need testosterone in order to be able to make estradiol, okay? The second word, estrogen, I already told you, and estrogen is basically a female sex hormone that is responsible for the regulation of the female reproductive system. For example, ovulation, menstruation, all of these types of things. And also the development of secondary sex characteristic. Also, estrogen is also present in both males and females. Okay, so good to know. Testosterone and estrogen are like both present in males and females. It is not because you're female that you don't have testosterone, and it's not because you're a male that you don't have estrogen. Your levels are really low normally. So if you would test me, hopefully my testosterone level is going to be low, but it's not going to be 0. Okay, so if a girl eats food that has a high amount of cholesterol, they will grow beards. This, that may seem like a dumb question, but it's not. If you have a normal functioning body, all of your hormones are kind of like, it's called homeostasis. So basically all of your hormones kind of like balance themselves out. And the easiest way that I can explain this is if you eat an entire pie, you're not going to get diabetes because your body and your pancreas are normal. So they see you have a high influx of sugar, so they will actually secrete a high amount of insulin in order to lower your blood sugar after the 2 hours, like after 2 hours of consuming the pie. And that's the same thing with fat or high cholesterol intake. Then a cyst. A cyst is actually something that can occur in the entirety of your body, so not only in the ovaries, but basically everywhere. It is a cavity that is unnatural, so it's not supposed to be there, and it can be filled with air, with fluid, or something. And when we don't know what it's filled with, when it's something, we always think of a very fancy name in medicine because we love to make things difficult, a semi-solid material. So it's not fluid, it's not solid, it's just like sticky or whatever. It's garbage that's in it, okay? In polycystic ovarian syndrome, as you can see in the picture here, I hope you can see my cursor. So here you have like a normal ovary. This is what it normally should look like. And if you would cut it through, it just looks like, you see, you have like here your ovary, you have your egg cells, and they kind of like turn into, you know, an egg cell in the follicular stage, and it can kind of, if there is like, you know, if you do stuff, you can get babies. But in polycystic ovarian syndrome, this whole thing that you see here that is so pretty, that does not really occur, because your ovary, as you can see here, is full of cysts, which are like these weird, unnatural cavities filled with stuff that is not supposed to be there. And if you have stuff that is not supposed to be there, you can understand that the function of this thing is not going to be right. To compare it with, you can have cysts everywhere in your body, okay? Also in your lungs. So this is an example of a man, and this is an x-ray. Good to know, actually. If you look at an x-ray, left is right and right is left. So in this x-ray, we see a lesion where? Left or right? I want to know. Tell me. Where do you see something that is weird? So left, you see something that is not right. So the easiest thing is always compare. This is normal. Everything that is black is air on an x-ray, and everything that is white is either fluid or bone on an x-ray. So you see left here, this weird thing that's not supposed to be here. It seems to be like oval shaped or anything like that, and it's kind of like filled with like a substance. Okay, so this is a cyst. This is an example of an extreme cyst. Okay, so, and then the last word, the hypothalamic pituitary ovarian axis, is a really difficult word, but the only thing that you need to know about it is that it is a system that controls the female reproductive organs, okay? It's kind of like the control system that fixes everything, that makes sure your hormones are in balance, and that makes sure that you have a normal period, and that you can get pregnant, and all of these types of things, okay? This is like the control system in your brain. The hypothalamus is basically like an overall watcher. It's kind of like, I would say, is the boss of all of the homeostatic systems in your body, okay? So it regulates your body temperature, your blood pressure, your heart rate, your sleep-wake cycle, like basically not everything, but a lot, okay? And it is situated right here, right on top of the pituitary gland. And I always kind of thought this kind of like looks, you gotta know what it looks like, right? And I don't have to say it. And your pituitary actually makes a variety of hormones, and one of those hormones controls the male or female reproductive systems, okay? So you can understand, if there's a problem here, you will have a problem here, okay? So what is PCOS? Women with PCOS, they normally have abnormalities in the metabolism of androgens and estrogens. And metabolism is basically producing them, okay? Or getting rid of them. And in the control, so your hypothalamus and pituitary axis of androgen production, okay? So PCOS can result from an abnormal functioning of that hypothalamic pituitary ovarian axis. Signs and symptoms. What do these women suffer from? Okay, the major symptoms are menstrual dysfunction. These women, they won't get their periods for a long time, or they will get their periods for months at a time. And I can tell you that's not fun, okay? They can suffer from anovulation. And to understand what the anovulation means, that basically means that you don't have an egg cell that you can actually get pregnant from, okay? And the third thing is that they have signs of hyperandrogenism. Okay, what does that mean? Hyper, too much, Androgenism. So basically they have too much male hormones, causing them to have symptoms as if they were getting to be a man. So you can understand, if you have too much testosterone as a female, certain female characteristics that you have, they might disappear. For example, you might actually get an excessive amount of hair, you might get a mustache, you might get a beard, you might get chest hair. This can go really, really far. You can understand, if you as a 16-year-old girl have PCOS, you can understand how debilitating that is for a woman to have male characteristics. So whenever you see a woman that, for example, has facial hair or too much that is like really hairy, you might think like, oh my god, like that's weird, like what's wrong with her? But do know that these women, they can't really help it, okay? So if you have a little bit like this woman has, she has like a little bit here that can be normal, especially Mediterranean woman. I'm Mediterranean and I have that a little bit, so that's really easy to get rid of that. You just wax it. But you can understand, if you have real male beard-like features, that's really hard to get rid of, okay? So always try to be respectful when you see something like that. Just think, you know, this woman might have PCOS or any other type issue that causes her testosterone levels to be so high, so she can't really help it. So this is like the picture that I told you. It's not just the hirsutism and all of that, you get like lots of other things. So weight changes, very difficult for these people to lose weight. They get the ovarian cysts like we talked about. They have lower sex drive, which is actually quite, you would say, quite weird. If you have like high testosterone, you would think you would get actually higher sex drive, but you don't as a woman, because our sex drive does not come from testosterone, it comes from estrogen. So that's why we have, I mean, not we, but like patients with PCOS, that's why they have lower sex drive, irregular missed periods, also baldness. They can actually start losing hair, and they can get actually a male type hair loss, so they get like this crown hair loss, which is also very debilitating if you suffer from that as a woman. High testosterone level, insulin resistance, causing also obesity, or the other way around. They can get tired, they can get acne, sometimes even very, very, very severe acne. So also when you see people with acne, just don't judge them, you know, it's a medical condition. It's sometimes very, very hard to treat, so just so you know that. And they can also suffer from mood changes, not changes, and obviously infertility. So why do these women get PCOS? We don't really know. There is lots of research done on this, but actually not a clear answer. Like that's why I also gave you a little bit the introduction with the vocabulary, so you kind of like can understand a bit the mechanism, like how you can get this. So basically, if you have abnormalities in the metabolism, so the making or the breaking of the androgens and estrogen, then you can understand that you can make too much testosterone or too little estrogen, or you have a problem in the control center, okay, in the HPO axis, or you have a high concentration of testosterone. We don't really know why or how that happens. You can have a combinations of these things, and you can also have too much or too little of certain hormones called LH and FSH that actually cause testosterone to start forming or cause estrogen to start forming. So basically, if you have too much LH, then testosterone will be forming too much. If you have too little FSH, which is also a hormone, then you won't have enough estrogen. Do you have certain risk factors? Yes, obesity definitely is a risk factor for you to get PCOS. Genetics, we're not really sure. I think I saw a study where there was a study conducted, I think it was in America or so, where they did some gene studies, and they did find some genes that were correlated with PCOS, but it's not proven yet. So it might have a role to play in it, but it's not completely known. So basically, whenever people come with symptoms, like this, especially if you have irregular periods. The first thing that you have to exclude is malignancy. And when we talk about malignancy, we talk about tumors. One of the most deadly tumors are ovarian tumors. So that's the first thing that you want to exclude. So just so you know, ovarian tumors are basically the deadliest tumors out there. Laboratory testing, really well done, really good. That's exactly what you need to be doing. First of all, not only to test for testosterone or other hormones, but also to exclude other causes. Thanks for the host. Other causes that could explain PCOS symptoms.
So I go by Amethyst on Twitch. As you said earlier, I'm redoing my Twitch account and revamping. I used to be Amethyst_0214, and I'm going through like a whole name change and changing like the themes of my streams. I'm actually going to be doing more of a like, I guess, mystical, witchy kind of stream. So if anyone's interested in that, that it would be fun. Follow me and keep up to date with us. So for me, one of the last things I went through with my PCOS is I was first diagnosed and I had insurance for a minute then, and then I lost it. So I just lost all of my treatment and stuff and just kept on going. I got insurance back for a minute, went back to get treated, and then when I did, something about being put on birth control, I mean, it did it the first time too, but it kind of quit after a couple of months. But my body doesn't do right with it or something, and it causes me to bleed uncontrollably. I bled for like 2 months straight. And not just like a little, like a lot. Like I went back to the doctor because I was like, something's not right. And they were like, oh, well, let's check to make sure you're not anemic because, that could be dangerous. And then she was like, so I know this sounds counterproductive, but I gotta take some blood. And I was like, okay. So she pricked my finger and she walked out. She's like, oh, you need to be like taking iron supplements like yesterday. Holy crap. So I ended up having to go on iron, and it to stop the bleeding, they tried to put me on like 2 different birth controls at once. And finally it quit, and about the time it quit, I was not able to go back. And then that's just kind of where I'm at now.
When's the first time you actually realized something was wrong, that you were sick?
High school. My cycles never regulated. Like, when I first started, my cycles, I was like 10 or 11. And they never were regular. I couldn't keep a calendar and know, oh, they usually come about this time. It wasn't me. And everyone in my family that I told, like, hey, this is not going right. We're like, oh, well, you're new at this, you're young, your body will regulate as you start going through puberty more. Like, it'll be fine. And it never did. Mine have never been like clockwork. They happen whenever they want to.
Did you suffer from any other symptoms that we talked about in the presentation? Anything else that you noticed, or in hindsight, knowing about the disease, that you were like, oh, I actually had this, or this was something that happened to me?
A fun thing is I've actually learned a few things watching your stream that a doctor never explained to me. They just was sort of like, here's a bunch of blood work we need to do to check some things. Oh yeah, it's PCOS, it's fine. Like, here, take some medicine. So nobody ever really explained it, but for me, my aunt has it. So it was just sort of, I kind of knew. I do know that with symptoms, it is varied. There's a lot of symptoms, and some people have a lot, and some don't. I do have anxiety issues and mental health issues, which I know you said can go into it. As far as the hair, I have like a little spot right here. The skin, like, you can even tell the skin texture is different where that's at. I'm wearing makeup, so you cannot see, but I do have acne. I do suffer with acne really bad and oily skin. As far as hair loss, I shed like a dog. And I mean, oh God, obviously I'm plus size. There's a lot. I mean, again, the cycle's not being right. Low sex drive. Rip my husband. I'm very sorry.
Yeah.
As far as infertility, that's probably an issue I have. But luckily, I don't actually really want children, so that's not something that's really affected me like that. Like I know it does a lot of women. There does come a lot of pain with it, and it can make, like, not to be graphic or anything, it can make sex painful. Yeah, I mean, I have a lot of the symptoms. I do suffer a lot with it. The fatigue, oh my gosh.
Yeah, I find it very. Maybe I just gotten lucky, but everyone that I've interviewed so far, they're also like they all ooze this strength, even though they struggle with real things, and actually the fact that you don't have insurance, that therefore you can't get treated, it's horrifying. It's something that we in Europe we cannot really imagine, to be quite honest. So props to your strength, but it must be very difficult for you as well, because you said you suffer from anxiety and all of that. Is that something that is intertwined with your PCOS, or is there something different?
Now, I don't know if it is caused by it or if it's just, there, because I've had a lot of other things happen, and mental health is really something I struggle with too. But someone's in here saying that if you see her right now, I hope she's like this all of the time. No, I'm not.
It's mostly like that. We get to see the best of you.
Yeah, no. I have a lot of down days, and there's a lot of days where I really, because of fatigue and things like that, I question myself, because it seems like other people can get up and get so much stuff done, and I can't. And I'm like, why? This is simple housework task. Why can't I do this?
Yeah.
Like I said, I mean, fertility issues is not something I am necessarily concerned about, but for a lot of women I know that have PCOS, that's really heartbreaking. Like that is oh my gosh, I mean, because the treatments cost so much to even try to get pregnant, and or just to know, like, some doctors are really willing to work with you and go, yeah, we can figure something out, and others are like, oh no, you have PCOS, you're not having kids.
Yeah, so it's like a lot. All of a sudden you get like a diagnosis, all of a sudden maybe you have never been on medication, and then you were. I
wasn't. I was not taking anything at the time, and just all of a sudden it's like, oh, here's this birth control, and then they put me on spironolactone and metformin.
Spironolactone is used in control of high blood pressure, but it is also an anti-androgen, and metformin basically is against insulin resistance, and also people with diabetes use metformin, just so you know what those medications are doing. So you're actually a little bit of a victim of your healthcare system in America. Do you have any?
Currently.
Yeah, I find this so fascinating, and just like so weird that this still is a thing. Do you know if there is anything that's going to change soon, or if there are systems in place for people like you that kind of fall out of the boat?
I'm not aware of any of that. And in fact, I feel like when I had went back to the doctor that second time after getting insurance the second time, that the office I was going to maybe took on more patients than they should have. And so where the first time I went through, it was really, let's listen to you, let's find out what's going on. The second time around, it was like, okay, person in, person out, person in, person out. And it wasn't, they didn't really listen to what I have going on. It was just, oh, try this birth control, try this one, try this one. And so, I don't know, the second time I went, she asked me, she's like, well, have you been to a specialist for it? And I was like, they're specialists?
Yeah.
Like, no one told me that.
They're basically gynecologists, they're specialists in that. If you would go to a doctor's office, just out of curiosity, without insurance, how much would a visit cost?
I know just for going to what we all call here a doc in the box, like a family health care, just regular. Those can cost $200 or $300 out of pocket due the day of your visit.
For one consultation.
Yeah, and that's just for if you have to call out of work because you got like a virus or something, a cold, and you need to go to the doctor. And yeah.
That is insane. To go to a specialist in Belgium, and that's like a hyper specialist, let's just say like the one that earns the most, which is like a dermatologist or something, that can cost you up to €75, €80 depending on what he does, which is basically like not even $100, and that's like a hyper specialist like that probably already like did some tests on you, so that's insane.
Even with insurance, every time I had to go back to the office because of my excessive bleeding or the birth control not being taken right, it was considered a non-necessary visit, so I had to pay like $50 or something like that for it, just for that visit, and that was with insurance.
That's insane. That's actually insane. So if let's say you do have an emergency, God forbid, let's say you do, what happens then?
A trip to the emergency room, that can go, $600-700 just for the visit in there. That's not including your medicines. That's not including what happens if they have to put you into the hospital. Like if you have to be admitted, that can go way into the thousands. So as of right now, I've currently looked up online and done a whole bunch of my own research for like natural vitamins and things and natural supplements that can maybe kind of help. So I have a few that I take now to kind of try to help me some, but I don't know if it's actually really doing much for me or not.
Yeah, it's quite difficult in that sense because vitamin supplements, if you just know a little bit how it works, it's not really going to do much. I think the only free thing you can do is basically diet and exercise, and that's not going to take your PCOS away. It's just going to take a couple of symptoms away that you have, or certain risk factors, like when you're getting a bit older, like the cardiovascular risk factors or the diabetes or anything like that. It might diminish your chances of getting that.
Most Americans, from what I understand, do have substantial medical debt that they just pay on little by little each month, $5 or $10 here or there.
You said when we first started our interview, you said I actually learned a couple of things from you. It's actually quite nice, to be honest. I always feel good when people say that. What did you learn?
Yeah, because like I said, a doctor never really sat down and explained to me, okay, so this is your diagnosis and these are some of the things you could probably, like I never had that. And so I did not know that it can cause sleep apnea. I didn't know that. I do have sleep issues, so now I'm like, that makes some sense.
Yeah. And like about the reason why you experience these symptoms, so like a little bit of the physiology behind it, like the fact that you have too much testosterone and all of that, are those things that were new to you, or is things that you already knew?
Now the actual knowing that it's a hormone imbalance and what that is, yeah. Now the whole being related to the cholesterol part, no, it's not.
No. That's actually quite bad, because I hear this a lot. Patients are very badly informed about their medical history, and the older they get, actually, the more this is. So I had this so much as an intern that I would see a patient that was like maybe 50 or 60 or so, and I'd ask him about his medical history, and he would just say, I don't know, I have something in my heart, and like my lungs are not good, and like that's it. And I would be like, yeah, but what conditions you have? And they just couldn't say it, because either they didn't know or the doctor just didn't explain it well. And I find that is so bad, because I feel like patients have the rights to know what's going on and what's wrong and how they can fix it. It's quite difficult actually to find good information out there. It's also a little bit what motivated me to do these streams, to kind of like explain medical stuff really easy to people, because it's just so hard sometimes to find good information.
Kind of interesting that you did this stream right here at the beginning of September, because September actually is PCOS Awareness Month.
Oh, really? I did not know that.
Yes, it is.
Oh, well, lucky me. Wow. Is there something else, like kind of like as a closing argument, closing statement, something that you want people to take away from this, something that you want them to remember?
I guess it would just be that, you know, if you have women that you know in your life that maybe you do or you don't know that they deal with things like this, there's a lot of different symptoms. Not all of them experience it the same. For some women, it can be really bad, and some it might be just kind of mild. Like, you really kind of need to take a little bit of sympathy on that, because there's a lot of women that deal with way more than they will ever tell you. It's not as debilitating as, say, having like a severe condition, you know, but it is difficult. It does give hurdles that you have to get through, and you know, a lot of those, especially with the way the world is with women and their image, it can hurt, because you know, most doctors are just like, oh, lose some weight, and everybody's like, oh, lose some weight. But when you struggle to do that and your body is rigged against you to make it difficult to do that, like, it can be discouraging, it can be, like, it's hard.
I actually, I find you a very, very positive person, and you look so bubbly. I really like that.
Thank you.
Thank you. And I really want to thank you for being here, taking the time so early in the morning for you.